And it's recording. So great to see you guys. I see there are some people interested, some familiar faces, some new faces. It's always great to meet you here. Today we have a special guest. We have Eva, who has been with me every MedTalk so far. And we have Kim here, which is very new to the world of MedTalks and medical communication, but I'm really happy to have her here. And we are going to talk EUPATI, which is European Patients Academy on Therapeutic Innovation. And I believe it needs to be heard, the message they have to tell. And I'm really looking forward to our discussion today. So to start with, I would like Eva to tell us a bit about her, and then how do you know Kim?
Yeah, I think some of you knows already. I'm a former nurse anesthetist and ICU pediatric nurse, and have been working internationally in different cultures too. And 2012, I was invited by American companies to start doing medical translations, which also ended up in LVC processes. That means linguistic validation consultant. So I did different translations and prepared consent and the questionnaires, and then I did also the cognitive debriefing for Sweden and also Sweden, Finland. And that's how I came in contact with Kim, actually, on a cognitive debriefing project I helped. And I find it very interesting in how the questionnaire should be presented in her way of thinking, and I find it very interesting. So after the paraphrasing of the questionnaire, we continued, talked a little bit, and she presented herself as taking the course here in EUPATI. I have seen it on LinkedIn earlier, but not really grasped the consent of it. So I find it very interesting, and the engagement of patient involvement in this clinical trial process is very interesting. So I was asking her, because I knew she took the cohort 8 during autumn here, so I was waiting a little bit, and then I asked her if she had interest of coming here and talk to us. So I hand over to Kim then.
Yeah, hello everybody. I'm Kim. I was born and raised in a small town called Härnösand in the northern Sweden, and I was born with severe asthma and allergies. And I have always felt alone in my illness. None of my friends or anyone in my family, luckily, were ill. So I was the only one who needed to take medications and go to the hospital. And after I graduated in Härnösand, I moved to Linköping, where I live today. And here I came in contact with this organization called Young Allergics. And for the first time in my life, I didn't felt alone. I met other people that has had the same asthma journey as me. So I become involved in the national board for Young Allergics. And that was when I came in contact with patients' involvement and patients' advocacy. And I came in contact with EFA, the European Allergy and Airway Diseases Association. And at that time, they had this young council for young people that wanted to learn how to patients advocate. So I joined them, and I went to Brussels with them and did this training, and we learned how to advocate and how it works to be a patient's advocate in the EU level. And after that, I received email from IFA every month. And then I got this email that they were offering 5 scholarships to do this EUPATI Fellow training. And that was the first time I came in contact with EUPATI. And I haven't heard about EUPATI before. So I started Googling EUPATI, and I came in contact with EUPATI Sweden. And they are having this training on Swedish. So I did it on Swedish first to understand what it was handling about. And I really liked it. So I searched for the scholarship, and I got it. And about 1.5 years ago, I started to do this EUPATI Fellow training.
Amazing. Let me just I have 2 questions.
Yeah.
First of all, how old are you?
I'm 23.
23. Yeah, you look very young. So amazing journey. And then I wondered, your asthma, your allergic asthma, is that somehow genetic? Is that somehow where you, or do you know where that comes from? Are you in some clinical trials? Is the EUPATI somehow involved in clinical trials? Could you guide us a bit? Yeah.
We have some asthma and allergies in my family, and relatives have some asthma. So I think it's a bit genetic in my case, but I haven't been in any clinical trials or anything like that. So that was new to me when I started to read about it.
Yeah. So you're still not on a clinical trial for some new medication, just to make this clear. No, because I thought you were. That's good we talk about it.
No, I haven't been a patient myself.
Yeah.
Any clinical trials, but
maybe that is a good base to actually explain to us and my listeners, or our listeners, who or what is EUPATI? What do they do?
Yeah. All right. So I will take some quick facts about EUPATI.
Amazing. Thank you.
So EUPATI stands for European Patients Academy on Therapeutic Innovation. So is this European education initiative aimed to strengthen the patients and the patients' representatives, knowledge of research, drug development, and regulatory processes. So EUPATI works to enable patients to participate in an informed, meaningful, and professional way in the development of new treatments. By increasing patients-oriented expertise in medical research, both the quality and relevance of the development process are strengthened. So today, EUPATI offers several types of education resources, including the comprehensive EUPATI Fellow training program. So that was the program that I went later, the EUPATI Fellow one. EUPATI has open and freely available EUPATI toolbox. So it's a knowledge library with materials on research and drug development. So the organization also runs national EUPATI academies in several European countries, and including Sweden. So we have EUPATI Sweden here. And that is to like strengthening the patient participation at the national level. So for me, EUPATI Sweden was really important. Just to start with the education on Swedish, because I talk Swedish, that's my mother language. So it was nice for me to read everything in Swedish first and get like this ground to start.
Yeah. And what is your plan with that knowledge? Like now you have done the courses, where's it going to lead you?
During my course, EUPATI Fellow, I noticed that patient representatives today are getting increasingly important place in these processes, and it's really needed. So patient participation today feels like it's moving from being something you should do to becoming like this obvious integrated part of developing new treatments and medications. So I feel like we have this important role today to continuing being this patient representative and like help the industry with the patient's perspective and doing new treatments and the medications more patient friendly.
Definitely, I feel that too. For those who don't know me, really, I work a lot with clinical trials and patient-facing material, and I see in my network the discussion coming more and more that there is more patient voice needed. Also, I mean, people who are in industry for a long time, they say it was always like this. But I've always believed in the good, and I do believe that the more patients get involved and the more advocacy happens around or coming from patients like you or like Jamie, my last guest I had here, the louder you get and the more people will see you and hear you. And at some point it's inevitable that they must listen, you know, so. And yeah, I'm really happy to be a part of this. And I really think that your work is very valuable. And would you like to tell us, I still have not a real picture how that works, like what you are doing on a daily basis or weekly or monthly, how does it work, and what kind of stakeholders do you work with?
I'm actually trying to figuring out that questions myself, because today after you graduate, there are not like this clear path that you're going into. So right now I'm actually trying to figure out how I can help in the best way and where to start. So I have had a dialogue with EUPATI Sweden, and they have helped me a bit of telling me how things works in Sweden, because it's different everywhere.
Yeah.
I learned that in Sweden it's easier to be a part of an organization and advocate from there. So right now I actually don't know.
Yeah, well, that's okay. That's a good answer.
Yeah, connect to people and like learning on the way.
Yeah. And are you did I hear that right, that you are in kind of a youth department, or was that in the past, or is it still?
I was that in the past, but so I'm not connected to anything right now.
All right.
But I have had some conversations with the Asthma and Allergy Association in Sweden. So I hope maybe I can do something more with them in the future.
Yeah, they would be lucky.
Yeah, but during the education, I became interested in like the authorities and like the rule work in Sweden.
Yeah, yeah.
I'd like to learn more about that and maybe be a part of that in the future.
That sounds very valuable. Yeah, there's not a lot of people who like to get into this. Yeah, I can imagine that this becomes kind of a group of people who meet, like maybe like How to Speak Cancer Family, or like the MedTalks group, when we have like the same people, and then you can brainstorm together and get. I mean, what you need is to reach the people with your diagnosis and the other stakeholders. I must say I'm not a big fan of the Swedish healthcare system. But that is another point. It definitely needs to be improved, but not just the Swedish, like basically everywhere. But yeah, it needs to be improved, and therefore it needs to have people who are also brave enough to, like stand up and talk and tell their stories. Because in the past it has been, and this is what I like about cognitive debriefing also, you give patients the chance to talk about it, because I can't speak for Sweden, but I can speak for Germany. It is, you don't talk about your illness. If you talk about your illness, now you have to be strong, you have to be, focused, and being sick has been seen as being weak. It's not like that anymore, but when I was a kid and when I was a teenager, it was like that. And thanks to guys like you who share their stories, you also empower other people to share their stories. And this is why things change in the world. And yeah, thank you. This is really, it's worth a lot more than you think.
I have just one thing to add. There are this EUPATI Connect, it calls. So it's this platform. So after you graduate to be a EUPATI Fellow, you are doing this profile on EUPATI Connect and tells a little bit about yourself. And then researchers and industry and people that need to come in contact with an EUPATI Fellow can do this application on this website, and then it will pair you to the right person.
Oh, that's perfect.
So
it's a kind of bank there where you can be found.
Yeah. So EUPATI Connect tips.
Well, that's perfect. Have you found some connections within your niche? Like, let's call it a niche. I can imagine you have different conditions and different groups there.
Yeah.
I
haven't got any questions yet, but I've only have been EUPATI Fellow in like 2 months now.
Yeah, well,
so it's new.
It needs time, yeah. And I mean, being here and talking about it is also, hopefully someone will see you, because I feel the spirit, I feel the power. You are one who needs to be heard.
I think because I applied for these scholarships and do this training myself, I don't have so much in my backpack. I think many people that do this education maybe are sent from an organization and from the job or anything. So I think it's easier maybe for them.
Oh, interesting. So it is not only patients doing this education.
No, exactly. So it's patients and patients' representatives and people from the industry are doing it too.
Oh, interesting. Yeah.
So when my graduation was in Madrid, so we were about 100 patients, 100 people that graduated then, and we have really different backgrounds.
Yeah.
So it's not only patients.
Oh, that is very good that we talk about that, because I thought it's only for patients. Like when you have a condition, you can get taught. Amazing. Yeah. So how would you sum up the foundations and core principles of EUPATI?
I would say it's based on patient power, so that patients should have access to high quality education in order to understand and influence decisions concerning their health. And we have meaningful patients involvement. So patient participation must be structured, systematic, and have real meaning, not symbolic. Patients are partners, not spectators.
Yeah, subjects.
Transparency and trust. Cooperation between patients and other stakeholders must be open, ethical, and based on mutual respect and trust. And we have equality and inclusion. So all patients, regardless of background, education, or diagnosis, should have the opportunity to participate and be represented. High quality and evidence-based education. So EUPATI offers factual and scientifically based education that enables patients to meet researchers, authorities, and industry on equal terms. So that's like the ground foundation.
Yeah. Wonderful. Now I lost. I'm lost. I had a question just when you were talking.
Yes.
Now I forgot it. But it will come back. How is? Oh yes, no, it's there again. When you say education fellowship program, how much time? How does it work? Do you have online courses? Do you have the toolbox, the resources? Do you have a time frame where you have to send in stuff? Would you like to tell us more about how this works?
Yes. So it's the most of the education is online. So you are getting a login to this platform, and then you have access to all of the materials. And it's in this like chapters.
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 Modules.
So you have modules, yes. So you have 4 modules, and every module has these chapters. And you are reading. It's nothing that, it's a few movies, but mostly you read the material. And at the end of every chapter, you are doing this quiz.
Mm-hmm.
And you need to pass the quiz to move on.
All right.
And in the spring, we have this online event. So everybody meets online, and they are föreläsningar. They are
They are held in speech.
and listen to
They are talking. They are like a webinar. Like they are holding speeches.
Lecture.
Yes.
Lecture.
All right. Or like so an online presence.
So
Webinar.
we have this online event for 4 days.
Mhm.
It's lectures and group assessments, and you can talk with everybody. So before the first online event, you need to have been done with the 2 first modules and have passed all the quizzes.
Mhm.
And after that, you have 2 modules left, and you need to have passed them to go to the Madrid event. In my cohort, we were in Madrid, but it's somewhere in Europe that we meet the last
All
week.
right.
And
what was that in Brussels? You went also to Brussels. Was that also in the same?
No, that was not connected to
Okay.
Patrick. That was with IFA.
All right. Okay. Sorry. I didn't want to interrupt. So you went to Madrid?
Yeah, and that is for 4 days. So the 3 first days, it's lectures and group assessments, and you can talk to other people and connect. And then the last day, it's graduation, and you get this diploma.
Amazing. And the costs of the trip to Madrid. I mean, not everybody who is sick can pay for this because often they can't work.
Yeah.
Do they get covered, or how about that?
If you are not on a scholarship or anything, you need to pay it yourself.
Yeah.
I know that they are a bit cheaper for patients. So if you're a patient yourself that want to do this education, it's a bit cheaper.
Yeah.
But,
Okay.
yeah.
But the education program itself is for free, you said, right?
You don't have access
Oh.
to all of the training materials that are for EUPATI Fellows,
Mm-hmm.
but they have this toolbox that are free, so you have access
Yeah.
to a bit of the material. And EUPATI Sweden all of their education material are for free, so everybody has access to it. And
Yeah,
they,
that's a thing I love about Sweden. They really value education here. That's true.
big recommend is to go in Sweden's education and look at it.
Yeah.
It's really good.
Yeah, I would definitely have a look at that. Now, I just wonder, do you have any? I don't know, you got the scholarship, right?
Yeah, I had this.
How did you do that? You just applied for it, or do you need any background for it to get it? Or
I applied it for EFA scholarships, and I read. I write this text and send it to them, and then it was interviews, and after that, I passed everything and got it. So
congratulations!
Thank you.
Oh, wonderful! It seems like you're having a path there. You know, someone is guiding you. Okay, how did you each get involved? I think we kind of covered that, but we didn't hear Eva's side so far. How deep are you into the EUPATI? Are you just learning about it, Eva, or are you also already as an advocate?
EUPATI?
Yes.
I'm not, because I'm a little bit busy with this and that, but I have been into this toolbox.
Oh, yes.
And what else is called on the EUPATI page is there. Anyhow, I've been looking into few things there because I came across something which is called SMPC, and demand to have experience or kind of course going through.
Yeah.
And I find that on EUPATI.
All right.
And then it turned over to medication administration and so on. But I started it, so I read about SMPC, and then it comes out to packaged leaflet and so on. So it's quite a huge lesson or webinar. I think it's called webinar. Huh?
It's webinar if it's like recorded. But I guess we understand anyway. So
so they have very nice and interesting courses, I must say, for everyone, even the one who is well educated and so on. So we shouldn't deny doing these courses, or you don't have to do the course. You can get some nice information from it. Yeah,
definitely. I mean, and that's why we're having this talk to spread the word, because I never heard about EUPATI before. But we are all in a network where if we spread the word, I mean, there are people who are interested in, right? If not our network, who would be interested in? And the more people spread the word, the better.
Yeah.
So
I find it very interesting and very updating too, because it's a new process in the whole linguistic validation process. To invite patients. I wasn't sure everyone could do EUPATI. I have seen you can be fellow or patient, but I didn't know the industry also may do the involvement in it, because as I can see in EUPATI structure on the diagrams, they talk about the patient as a member early in the process of clinical trial. Have I understood it right, Kim?
Yeah, I think so. Yeah.
This is also what I got the impression of EUPATI is more. It's more patient face. So
I don't think the industry people can replace a patient, because the patient is coming into the nowadays the linguistic validation process. It's when I'm asking Kim to go through the questionnaire with me in a cognitive debriefing. That's the part where the patients come in, and it's only the patient that can evaluate the questionnaire.
Yeah.
An industry person cannot do that. It
No.
has to be patient. So I don't know, maybe they have a little bit different view on their...
No, but maybe they only want to educate industry people to understand that this is necessary.
Yeah.
Is someone from EUPATI here today? Besides Kim, of
Yeah.
course.
Elisabeth,
That would be
yeah.
who someone was here, right?
Elisabeth, are you from EUPATI Sweden, or?
Yes.
Yes, maybe you can answer the question. What is behind the fellowship and industry people?
Mhm.
Nice to meet you, by the way.
Yeah.
Yeah.
We just jump on to you.
And I met Kim a couple of weeks ago in our office, and we've been talking about EUPATI before, about EUPATI Sweden and about the fellow program as well. And we've seen that people from the industry, such as trainees starting to work for a pharmaceutical company, they come to us to get a grasp of what they're about to work with in the company. So we see that all kinds of people do our training, but the main group we want to be in contact with are just patients. And that's the same thing for the fellow program as well, but they don't stop anyone, and we don't stop anyone either. So
Yeah, it's again about spreading the word, right?
yeah.
Yeah.
And as Kim said, our training is free, so anyone can register and see what they want to go through, the whole program, or just a module.
It sounds perfect. Yeah.
Yeah.
I see myself signing up already.
Okay. Yeah.
No,
you're
seriously,
welcome.
it sounds
You're
so
welcome.
interesting.
Yes, it
it
is.
sounds really interesting.
Yes.
Yes. And we
Maybe you are
try-
also the right one to ask the question, which we see on the screen. What is your mission for the upcoming discussions, not just with me, but with everyone? Seems to be like you are the right person, Elizabeth.
Yes, Kim mentioned that there's not a job waiting when you graduate, and we have the same thing in Sweden. There's not a mission, there's not a path you can go, but we try to match scientists, researchers with patients. We're just about to establish that. We have several members in EUPATI Sweden who are pharmaceutical companies, some hospitals and patient organizations. And when people come together and talk about problems we have to solve, then they find each other, and we want to
Connect.
Yeah,
Yeah.
that's right.
Great. That sounds amazing. Thank you for that.
I just
think-
something that I was thinking of. Like Eva said, it's only the patients that can read these forms, and not this industry person. And it's really important because the patient's voice can't get lost. We need to involve patients. It's really, really important.
Patient can never be replaced, because the whole thing is about how the patient reacts and how they experience their condition.
Yeah.
Absolutely.
Well, I can't replace you and you can't replace me.
Yeah.
I mean, there wouldn't be a clinical trial without patient,
No.
would there? Like,
No.
it always comes down to this.
Yeah.
Everyone
So,
who works behind the scenes works for the patient, but somewhere the patient itself got lost. But yeah, as I said in the beginning, I think it's getting there.
Yeah.
Slowly, but
Yeah.
it's getting. And the more people talk about it, as I said, the better.
Yeah.
Yeah.
Can I add something?
Yes, of course,
I think
of course.
patients as well can help highlighting which problem is the one. What problem do we patients want to solve when it comes to a disease? Researchers know a lot, of course, but patients live with their conditions day in and day out, and they
Yeah,
but
definitely.
nobody wants to waste money. Researchers, pharmaceutical organizations don't want to solve the wrong problem. So
That's the case, right? It's in our linguistic world the same, like getting fair rates for translating so important documents is tough. People don't see the necessity of going over Google Translate, and being specific and localized. And I wonder, because actually life science, biotech, it's those who have the money,
money. It's a lot of money. That's
I live very close to Basel, to Switzerland before. I went to Sweden, and there was Roche and there was Bayer, and they have their campus there, and I knew people who worked there. It's just insane what kind of money they put into this, just in the leisure they had. They had a gym for the lunch breaks. They had a massive lunch menu, all for free. They had a kindergarten for free and all this stuff, and it's great. I do not envy. I wish everybody could live like this, but I wonder why those people are the same people who save money when it comes to the really important things, But then again, it is my perspective, and of course I am the one on the other end. It would be nice to have someone from the industry here to talk about it.
And I think it's not the subject to talk about, the economical part, because it has a huge support from founders or from the EU or from the governments, because they want to find solutions, and it's there. They have to find solutions, and also at the end, when the product comes, they will gain on selling the products. So because it's not always for free one, but what I like also with this engagement with EUPATI and EU, it's necessary to open up the countries, the frontiers.
Yeah.
Because we are talking about asthma is not a small condition, but you have all the other small rare diseases we're talking about, and it's maybe 3 in Sweden, 1 in Finland, 8 in Germany, and so on. Why shouldn't it be all together?
Right.
It's also much easier to do the clinical trial if you open up the frontiers, and also come together with unite the whole system. It shouldn't be the governments in each country, because I have experience from that too in cognitive debriefing I've done. For instance, for cystic fibrosis, it's a genetic problem you have from newborn. They found out a very effective medication for that, and it was presented in Norway, Sweden, and Denmark. Denmark made it possible for their patients with cystic fibrosis to have this medication, but Norway and Sweden found it too expensive, so they didn't get the treatment. And when I hear such a things, it's really breaking my heart, because why producing an effective medication and the persons who need it can't get it? No? It's not fair.
Well, that is a question. That is a general question. I mean, the many countries. Let's talk about Asia. There are so many countries who don't get the same treatment options as we are in the rich countries here in Europe or America, right? Or Africa or whatever, South America. So many people don't get the same treatment, and this should actually not be possible in medicine. Medicine should be there for all, and.
But now I'm talking about this democratic, rich country as Scandinavian country, Denmark, Sweden, and Norway. And they are not. They are refusing. 1/3 of the countries giving the treatments. So and then you can imagine what happened in the poor countries, as you talking about, Katrin.
Yeah. Well, it would be really interesting to have someone here to answer those questions. Yeah, to like a politician. Maybe that gives me food for another MedTalk. Let's get someone from the politics here.
But also to get in the patients early in the trial, in the clinical trial. I was thinking about, I had it on my tongue when Elizabeth talked about it, but then I came into another subject here. But to have them into the clinical trial early, they can help the researchers to get into the trace, as Elizabeth said, to go to the core problem in a condition, instead of going here and there and trying to find out the best medication for asthma, for instance, for Kim. They can go directly on the core with help of the patient.
Yeah.
Who knows a little bit more about the clinical trial process and how she can share with a researcher what's important to focus on.
That's true. Just getting the barriers also. That's what I like when Keith posts about that quite a lot, to open up the eyes. And you only learn that by talking to patients. How difficult is it actually with childcare? Maybe your parents you need to look after. You need to earn money. You need to go somewhere. My life is so full of stuff just with my normal life, a condition on top, and a clinical trial on top. And Keith posts, they open my eyes too, because I'm obviously luckily not a patient with such a condition. But I really love the discussion he's starting, and I think one thing we can. All of us can do to support these questions, to go to the people who need to hear it, is to share his posts, because they are so important. And we are, again, in a network where we have people from the same industry, and the more often they see these questions asked, the more it kind of melts into their brain and becomes natural for them. As I said, Angelo, in the other call about the book, it's like 7 times you have to be you have to see something 7 times to actually really recognize it. So Keith's post has to be seen 7 times by you to really understand and to be like, oh yeah, actually he's right. And once I learned that in a course, I observed that this is really true. Some things I see and then I forget. I see a second or a third time and I recognize. But it takes me quite a long time to actually really see and recognize something and be like, yeah, I need to dig deeper into this. And even though Keith is has quite a lot of volume of posts, sometimes it can feel overwhelming, but and we don't have to read and share everything. But I think this can be a good start to get the discussion to the people who are in need to hear it and to get aware of it.
The problem with the researcher, maybe they are so focused in their idea. So they have difficulties to let go of that and open up and see it from a different view.
Or
Because
maybe they were just never asked to do so, you know. You're in your bubble, we are in our bubble, and they are in their bubble. And maybe they just need to be like, hey, there's another point of view, you know.
And it's also a lot of documentations around it to even start the research program. So yeah, maybe Kim, you have to come even from the first thought. Patient has to be there before they establish the.
Eva, would you like to get more? We have another, I think, 10 minutes. Yeah, 10, 15 minutes. Would you like to get into this question and throw this question into the room?
Yeah, I think because when talking to Kim, I asked, of course, about her financially part of doing these courses and getting involved with the researchers and following the process and give all the advice and knowledge about being a patient with a condition, in whatever condition it is about. It should be paid in one way or another. I know by doing the cognitive debriefing, and not everyone even give a small fee for attending, but I have always had a tradition to give us part of my payment to every patient, because I think it's worth more than I have been able to afford. And this now we are getting into a more systematic involvement as a patient into the clinical trial system in a different way. I was consulting Kim, and I was myself consulting into doing this part of having the researchers' possibility to get contact with patients. Now they will put them as actually as a co-worker. So if the researcher get paid, I think also the patients involved in EUPATI processes in clinical trials should have a kind of a payment. And as I said, also as it said here, if not the researcher team will pay, it should be an sponsor group for these patients' involvement. It should be a sponsor group, because as I read and as I'm looking at in webinars, the problem is the patient. The trial can't continue, can't end, because of the patients is not, how do you say, finishing the if they are starting a trial, they are not finishing, and so on. It's a lot about this patient problem. And get them involved, pay them. I'm sure you will get a good response from them. Take them serious.
Absolutely. I mean, they invest a lot of time. That's what I meant before, and they also need to wrap their own schedule around the trial, and then they should have some support. I wouldn't even call it a payment, but you need support. And you can't go to work on those days. Some people, they travel, like Jamie. He travels 3-4 days to some study site, and then of course they need a reimbursement. I do think they get for travel expenses, but not for the loss of work, like for the work days you can't work, And
I have been listening, and I have been said many times to you don't have to go to the clinical site for doing blood sample. You can do that at home, and they can send it to the site, or the site may pick it up in 1177 as we have in Sweden, where all the data's come in. So it's I think they have to think a little bit different.
I just met a guy. I was at Link Medical. They had an event, just like a Christmas event, and there I met a guy. He works here in Sweden with. Is it very loud in the background? I'm sorry. He works with a collective where the nurses go home to the patients, like the study nurses are going home to the patients to do exactly that, taking blood samples, taking measurements and stuff, so that the patients have less of a burden to go somewhere. And I never heard that kind of...
in Sweden, you said?
Yeah, I love that idea. That should be also more promoted. And I am planning to have a call with him too, because I think this is a fantastic idea, and this should, another word that should be spread, just to make it a bit easier.
Sorry?
It's patient friendly.
Yeah.
You see from the patient's perspective that it's easier to take the blood samples at home. So it's really good.
Yeah, I love that.
In the commune area, you never bring the old patient to the lab for taking blood pressure, blood samples. The nurse, commune nurse, is doing it, so it's already established. So why isn't it possible? Because now I'm doing this a trial here, and I can only accept people living so and so far away from the clinical site. And as I said, all living up north in Sweden, they will never be able to attend a clinical trial because they are too far from the clinical site, and because the clinical site would never move to Umeå, for instance, or so on. So they limitating themselves by doing it this way.
Well, again, I want to be positive. I see that it is possible and people make it possible. And again, talking about it gives maybe a spark, like maybe someone in, like, listening to this, working somewhere in South America or America, thinks like, oh yeah, what a great idea. Why didn't I think of that? And then, you know, this is like the effect, that the ripple effect, I hope at least discussions like this have. I would like to give the stage to those who listen. Does anybody have any questions to Elizabeth, Eva, or Kim? There's not so many left, but
I have a comment.
Yes, or a comment. Now, yes, a comment is also welcome.
Can I?
Sure.
Well, first of all, Kim, Eva, thank you very much for being here with us. Catherine,
My pleasure.
You for the MedTalks. It's a great opportunity for us to learn. So I just wanted to say, Kim, I relate to and I sympathize with you so much. I'm speaking from Brazil, and I sympathize with your feeling of loneliness there when we first come across certain diseases. I am a type 1 diabetic patient. I've been diabetic for 40 years now. So I discovered diabetes when in the early 80s, when information was like, it didn't get so fast as we have information nowadays. So it felt even more lonely because I, for years and years, I never met actually any other type 1 diabetic person. So it feels lonely and it's hard.
Yeah, it is. And I think it's so important to meet other people that live with the same disease as yourself, that you can see that I'm not alone and I'm not weird, maybe.
Exactly. Yeah, and to feel some kind of support.
Yeah.
Nowadays, I'm lucky to have a healthcare team here in São Paulo, where I live.
Yeah.
It's a team from the hospital, and it's the Federal University of the state of São Paulo. They have a hospital, And there is this specific team that works with technology for diabetes, and I use an insulin pump. And it's great to see that most of them are type 1 diabetic people too.
Yeah.
So they understand perfectly, my problems and doubts and vulnerabilities and all, and it feels so great. I mean, it's not, of course, that doctors they have to have the same condition, but it's good when they do, because they know exactly what we're talking about.
Yeah, I imagine that. And when I am at the hospital and meet people who works there that has been sick themselves, they can understand me in a way that no other one can. Because it's these things that you see as a patient and feel as a patient that is hard to understand if you haven't been there yourself. So I'm glad to hear that your staff there knows what they talk about and understand.
So yeah, that was my comment. Thank you very
Wonderful.
much.
Thank you, Angelo, for
Kim,
your lovely comment,
keep
as
strong.
always.
Thank you.
You guys could connect. I mean, you seem to spark, and I this is what I love about MedTalks. We connect, and then we meet new people and learn from each other. And yeah, I'm always grateful when we did that. So for now, I would like to thank you for sharing your insights and for being here with us. I know, Kim, you were really nervous. No need to be. It was amazing. You were really well. You did it really good.
Thank you.
I will sign up for the EUPATI, definitely, because I really got interested. And maybe we get into more discussions together, maybe with Elizabeth or anybody else from the EUPATI team to, keep spreading.
Yeah, that would be amazing.
Wonderful. Thank you all for being here, for sharing your opinions. And now, Merry Christmas and a Happy New Year to you guys. It's the last
Merry
MedTalk for this
Christmas,
year.
everyone. Thank you.
Merry Christmas.
Merry Christmas.
Thank you, guys. Bye.
Bye
Thank you, Kim.
Thank
Bye-bye.
you. Bye. Thank you.
Bye-bye. See you.